It's about patient safety. That's the bottom line. That's not a partisan issue. It's something everybody wants. If that's my family member there, I don't want the nurse that's been there for 16 hours. I'd rather have that nurse that's maybe been there for 4 hours. As it was touched on, that it's been documented over and over again that the longer the nurses are there, the higher the likelihood of mistakes and errors. And again, this is about responsible governance too. One thing that I would hope that our state legislature would do is protect the most vulnerable in our society. I can't think of anybody more vulnerable than the patient laying in the bed sick. And that we shouldn't have to worry about is that facility going to make the right decision? They have to make the right decision with the law. And the nurses will be there rested and ready to take care and give proper care. It also creates a higher quality workplace. And again, it's been touched on about that this is one reason nurses have left the workforce in droves, is because of unscrupulous employers who have forced people to work as just a matter of practice, force them to work overtime. And I know in other states, nurses have come back in large numbers just because of the ban on mandatory overtime. And we talk a lot about the nursing shortage in this country. And there's the stat I've heard is that there's a third of RNs that aren't even practicing because of issues like this. Well, that's a huge number of nurses that potentially could come back into the workforce as a result of good labor practices. I'm a nurse at UW Hospital here in Madison, and where SEIU represents nurses, physical therapists, and occupational therapists. We have in our contract a ban on mandatory overtime, and it's worked very well. And we have no problems with staffing. The hospital has done a good job figuring out how to staff effectively, and at the same time that it increased their worker satisfaction, which is going to lead to higher retention in the field. And I just think that this is a no-brainer bill, and it's not Republican, it's not Democrat, it's just about patient safety. That's the bottom line. Thank you very much.